Today we're talking all about pelvic floor physical therapy. Let's get started. As you probably know, I've been a licensed physical therapist for over 20 years, and I recommend pelvic floor physical therapy to many of my clients. So today, we're going to talk about what pelvic floor physical therapy is, who may benefit, and what kind of symptoms you might be experiencing to tell you that you could be helped by pelvic floor physical therapy. So the first thing that we need to cover is, what is your pelvic floor? Every single human being has a pelvic floor. It is a group of muscles and connective tissue that make up the floor of your pelvis. So this is a human skeleton from the front. Here are the pelvic bones. These are your sit bones right here. And so you can see the pelvic floor itself is a group of muscles that acts almost like a trampoline or like a hammock that sits right at the base of our torso. So if you're sitting right now, all those muscles you're sitting on are your pelvic floor muscles. Those muscles are extremely important. So a few things that they do. One, they help support all of our organs. So really that includes our reproductive organs, our bladder, our intestines, our colon. So they're going to help in all of those areas. They are going to help us with defecation and urination. They're the muscles that help us not leak urine when we cough or we sneeze. They help support all of our reproductive organs as well. Those muscles also act as a shock absorbing system, really between our lower extremities and our torso. So anytime you take a step, you step off a curb, maybe you jump, you hike, anything like that, that includes that weight shift, that shock absorbing capacity, those muscles do those things. Finally, they not only support all of those organs down there, but they attach to our pelvis and to our hips, as you saw when I showed you a moment ago. So they have a really big emphasis on the balance that we have between our pelvis and our legs, what happens in our hip bones. Many times if you have something like hip pain or piriformis pain, those pelvic floor muscles can be involved because of where they attach. So all of that hopefully helps to tell you what the pelvic floor is and why those muscles are important. Pelvic floor physical therapy can be important when there's any kind of dysfunction involved in the pelvic floor. So for people who are experiencing symptoms such as leaking urine when you cough or sneeze or jump, so any kind of incontinence. Incontinence can also include defecation. So if you're having a hard time controlling your defecation, that is an incontinence issue and can really be helped by pelvic floor physical therapy. Things such as pain with intercourse, that can be helped with pelvic floor physical therapy. Any kind of pubic symphysis pain or pelvic girdle pain can also be helped with pelvic floor physical therapy. So those are some symptoms that you might be feeling that can really be helped. Also, if you've recently given birth or been pregnant, if you've gone through IVF, if you've had a hysterectomy, if you are experiencing a prolapse, any of those kind of life experiences or diagnoses, I highly recommend pelvic floor physical therapy in those cases, because with all of those things, there is some kind of either dysfunction going on or there has been a disruption to the balance of those muscles and those tissues. Those kind of issues also are things that we tend to brush off because we are either embarrassed or we are ashamed about them. Either that, or we've seen a doctor who has simply said, it's just something you have to live with. None of those things are true. I don't want you to be embarrassed. I don't want you to feel ashamed. And those aren't things that you just have to live with. Yes, they might be common issues. It might be common to leak urine after you give birth. It might be more common to experience a prolapse as we age. That doesn't mean it's something we have to live with. It is something that you can address. You can experience a more fulfilling life. You can be more comfortable in your body. You can exercise freely again. And pelvic floor physical therapy can help all of those things. So let's talk about what pelvic floor physical therapy is. So as I mentioned, I'm a licensed physical therapist. When we graduate from physical therapy school, we really graduate as a generalist. So we're taught in a whole general area. Then many people go on to specialize in different areas, and being a pelvic floor physical therapist is one of those specialties. So it is a licensed physical therapist who's gone through extra training to be able to address the pelvic floor. Another piece to this that I find is really important is pelvic floor physical therapists are able to do internal exams. So that means that they are able to internally check your pelvic floor muscles, either through the vagina or through the anus. Now, don't let that scare you. It is such an important piece. It's not painful at all. I personally have been through pelvic floor physical therapy many times after my own hysterectomy because of my own severe prolapse. It is extremely helpful. It's not painful at all. If you've ever had any kind of exam, it's going to be very similar to that. But they can do an internal check to check, one, if you have any tightness in your pelvic floor muscles, because believe it or not only can pelvic floor muscles be weak, they can also be very tight. If you do experience pain with intercourse or sexual activity at all, or any kind of pelvic floor pain, many times that can be from tightness, so they can check that for you. And they can also check if you're doing pelvic floor exercises correctly. That's also extremely important. I can be here giving you many exercises to do, but if you don't know if you are actually contracting the right muscles, they might not be helping to the full extent possible. So it can really be helpful and go hand in hand with the exercises that you're doing. So not only can they do those internal checks, but then they can also give you home exercises to do to help whatever your specific issue is. They can give you a lot of lifestyle management techniques. And to me, one of the most important things that pelvic floor physical therapists do is they simply help validate what you are feeling and going through. They're going to help you understand that you're not alone, that these are very common issues to have, and they're going to give you a lot of strategies to help get out of that dysfunction so you can go on to feel pain-free, that you can help your incontinence, and that you can live much more empowered every day. Now let's discuss the logistics behind seeing a pelvic floor physical therapist. So first off, you'll have to decide if you're going to use health insurance or if you're going to pay out of pocket to do that. Obviously, you can go either route. Also, ask around, ask your friends, ask your doctor if they know or they've seen a good pelvic floor physical therapist. Otherwise, simply get online and search. Search your area, search pelvic floor physical therapist. You can look at their website, you can call and find out when they can see you, find out what their specialties are, see if they have any extra things they offer, such as Pilates or dry needling or massage or anything like that that might help you make a decision if that's the right place for you. Also, please know many times you just need 1 to 3 visits to see a result and get some information. So this isn't something that has to be a long-term commitment. Simply commit 1, 2, or 3 times to go in and see a pelvic floor physical therapist to help you move forward. I hope that helps take a little bit of the fear away about seeing a pelvic floor physical therapist. As I mentioned earlier, I recommend almost every single one of my clients see a pelvic floor physical therapist. I personally see people for hysterectomy, both before surgery and after. I see people postpartum after giving birth. I see people for diastasis recti, prolapse surgery, how to exercise with those issues. So all of those people that I see can benefit not only from the exercise program and the strategies and the management techniques I give them, but then also in conjunction with that, seeing a pelvic floor physical therapist to make sure that those important muscles are being taken care of and are being exercised correctly. So I wish you the best. Remember, you are worth whatever time you can put in to feeling your best and moving forward 1 step at a time to feeling strong and empowered. I will talk to you soon.